Today we're going to talk about a lumbar discectomy. So if you get a herniated disc, which means part of the disc has torn and broken off and pushing out and it's hitting a nerve, it'll cause pain to go down your leg, as in sciatica, and can cause numbness and weakness down the leg. And nerve pain down the leg just kills people. The medications don't really help. Epidurals can help temporarily. Physical therapy and time may help. But if it's not getting better, then the surgery, we basically just go in and take out the broken off piece of disc. We don't take out the whole disc, just the 5 or 10% that's broken off, that's hitting the nerve. We just take the piece out that's putting pressure on the nerve. Now people think, well, if you take the disc out, don't I need it? Well, that piece is already broken. So that piece has already lost its structural stability. So taking it out doesn't decrease the stability of the disc. The disc has already been injured, and there's a risk it can go on to develop future problems and degeneration and other issues because it's been injured. The best way to prevent future injuries, get your muscles strong, get your back stabilization muscles strong to take the stress off the spine. But that piece of disc that's putting pressure on the nerve, if it's not getting better, and with non-operative treatment, then we go in and take the piece of disc out. We use a microscope, which allows us to make a very small incision to sneak in and basically just take the piece out, very minimally invasive. The surgery typically takes about an hour. Most people go home the same day. Recovery is about 2 to 6 weeks overall. Surgical pain for 3 to 4 days for most of our patients. Return back to sports is about 3 to 6 months. We published a paper on 85 professional athletes, and 89% made it back to their sport, and the average return was about 5 months. So you can get back and people feel great after 3 to 4 days, but at the same time it can take 5 months to really get back to a professional level sport. And for most normal people, it takes about 3 to 6 months to get back to all your high-end activities. There's always risk of complications from any surgery. There's risk of nerve injury, weakness, numbness, spinal fluid leak. Risk of an anesthetic can always be catastrophic. But overall, this is a very safe, reproducible surgery that if you're not getting better with non-operative treatment, it's a great option, and it's one of the best surgeries we have, and it really helps a lot of people get back to their life.